Welcome everyone to the Not Just Nursing Show. I am your host, Kara Severe, and this is Season 2, Something New. We have today Janelle King, also known as the Vagina Health Expert. That's right, the Vagina Health Expert. Join me in welcoming Janelle King to the Not Just Nursing Show. Welcome, Janelle.
Thank you. Thank you so much for having me, Kara. I'm so excited to be here.
Thank you. Thank you so much for being a guest on our show. You see, I had to pause for a second when I myself said the Vagina Health Expert. I'm like, okay, this is that show. So if you have any discretions or issues with talking about the vagina, vaginal health, we're going to be using scientific words. We're not going to be saying some of the other words that have been propagated in the community. So just understand this is going to be a very frank show. So back to our wonderful guest here, Janelle. So Janelle, let's talk about your nursing background. Tell us where you went to school and what your fields of study were.
So my entry into nursing is not traditional. I actually did not set out to be a nurse.
Hey.
My career actually started in public health. I worked at the state health department in Ohio for about 8 years before deciding to go back to school for nursing. I worked on a lot of policies and system changes, but I got a little bored with paperwork. I just missed people and helping people, so I decided to enroll in the community college in Columbus. I got my associate's degree in nursing first. That was the quickest route for me. We didn't have a lot of the fancy, bridge programs like they do today. So I decided to go with the associate's degree. And from there, I started working at one of the local hospitals. I started out in HIV outreach, like I did HIV outreach in the community, and then transitioned into adolescent medicine and teen health. So saw a lot of adults and children, talked to a lot of sexual health issues there. And because I worked at a magnet hospital, they, strongly encourage nurses to go back for their bachelor's degree. So I finished up my bachelor's of nursing at Capital University in 2016. And I currently work college health.
Yes. Still the community. Right, but college health, that's awesome. And as you were telling your story, it reminded me of my nursing background. I also have an associate's. The only difference is I just didn't go back to do that BSN. But yeah, definitely that associate's comes in handy.
It does.
Yes. You are known, Ms. Janelle, as the Vagina Health Expert. Tell us how you got that title.
So that has to be a shared title. I have been very fortunate to work with some of the best physicians in my opinion. Shout out to Dr. Anderson, Dr. Berlin, who worked in young women's health. So these ladies were so gracious. They kind of took me under their wing, and I felt like a mentee. They taught me everything they knew about the vagina and vaginal health, sexual health. They allowed me to assist with procedures, kind of explain why they did certain diagnoses and certain treatments. So from there, I think that's where my expertise arose.
Okay, that's wonderful to kind of be hand in hand with physicians and getting that one-on-one instruction and assisting them with procedures. That's awesome. I wanted to know about using the word vagina. Back in the day, that was such a taboo, intimate topic. So were you always comfortable using the terminology vagina, vaginal expert, things like that, or did you kind of grow into that?
So no, never. No, it's not a topic that, was used or not a topic we discussed at home at all. I never even thought I would be in this position to be talking about vaginal health. My friends back home, they would tell you, that's not the person I would pick. It's something that I grew into. So, in nursing school, you learn about the different systems of the body. I just found the reproductive system very fascinating. It came easy to me. It was interesting. I loved it. And I think for me, that interest and passion was cemented when I started my work in teen health. So we worked in a lot of clinics that were urban centers, and we had a lot of young women there who just had different issues or different misconceptions about vaginal health and sexual health. So it was my duty to inform them, and from that, I needed to know what I was talking about, so I had to do more research about that. So my passion grew from being able to explain to them kind of what's going on with their body and helping them to have the best possible health outcomes.
Right, I like that, making them feel comfortable because you feel comfortable talking about the vagina and calling it, all the terms scientifically that it is.
Right.
You spend a lot of time memorizing and looking at structures and calling it that. When we get out into the real world, it's like, oh, don't do that. Don't let this show.
Right.
So that's kind of interesting, but glad that you were able to kind of take on that step course of action. So with that and being able to talk about it and working with the young ladies in community health, in the nursing community, did you receive any sort of pushback? Like you mentioned some friends who were kind of like, no, now she's the last person that I would think, would talk about. Do you remember ever feeling like some pushback, maybe, oh, well, Janelle, maybe don't say that, or maybe that's too much information. Did you ever kind of feel that?
You know what? Surprisingly not. And I don't know if it's because I've just been surrounded with vaginal loving nurses and neurologists. I don't know if that's what the rationale is, or if it's because, how I present information. But I think I've been, people have just been very receptive to my message. I make it a point to let them know, like, I'm the expert, but I don't know everything. Please ask me questions. If I don't know, I'm going to find a way to get you that answer. I'm going to do my research to get you the best possible answer. And even with my patients, I let them know, like, no question is stupid, no question is silly. I am going to do my best to get you the best answer. And I try not to judge them. Like, I'm not here to judge you. I'm just here to give you the best possible care.
I think you have some magic, Janelle, because believe it or not, I am just like you. When you said your friends would say, that's the last person I would think that would talk about it. Literally, before you and I connected and I read about your platform, I would not have envisioned myself here today on the Not Just Nursing show talking about vaginas and sexual health. Like, I would have never really thought about that. Those are things we learn as nurses and in our own personal research, but I would never have imagined doing this show. So thank you for just being you and me seeing you embracing it, and just we're going to talk about some of the things on your blog and on your Instagram. It's just like, wow, look at her. Like, she's really asking these questions. So thank you, because it helped me to be able to, approach my taboo nature about this.
Well, I'm glad that you find it useful, and I'm glad that I'm able to share my expertise.
Absolutely, yes. So we're getting into something really interesting. The 7 fascinating facts about the vagina. Please share.
You know what's surprising about that, Karen? Like, that's been my most reviewed blog, and I'm happy that people find interested in that. So I just kind of try to dispel some of the rumors and myths about vaginas. So the first thing is, sometimes discharge is normal. Like, that happens, and it can be completely normal. Odor sometimes is normal. Like, it is okay. It's supposed to have its own smell. Your vagina is pH balanced, so there are things that you can do to maintain that pH balance, or there's things that you can do that throws that off. The vagina is a muscle, so it accommodates what's going on at that particular time. It stretches, it shrinks, like it's a muscle. So we got to remember it's a muscle. The vagina actually comes in different shapes. So just like we women come in different shapes, the vagina also comes in different shapes. Wow. The vagina is sensitive in certain areas and less sensitive in others, so bigger is not always better. And finally, if you want a good, long-lasting sexual health or sexual experience, you probably want a vaginal orgasm. That's probably the best route.
Okay, we're definitely, we'll get more into that. We'll get more into that. But as I'm going back over the list of things about the facts about the vagina, I had not heard it was a muscle, number one. And the second one about the different shapes. Now, I'm a nurse, and I put in my fair share of Foley catheters, done some pericare, right? Now, I do know the structure of the vagina can be different, where it's located, depending on age. But I did not know, shapes. So tell us, what do you mean by shapes?
So it actually comes in different shapes. There are different names. Like African American women, most of us, the large majority of us, have a pumpkin-shaped vagina. There's colonical-shaped vaginas. There are Hispanic women, they have vaginas that are shorter in the front, longer in the back. So that's what I mean by different shapes. We are all different beings, and we have different shaped vaginas. So that's why sometimes you can find that, certain positions or inserting certain instruments are more painful versus your girlfriend who could put the same tampon in and not feel any pain.
Right.
So.
We're going to have to collaborate. I'm just thinking of some things. I mean, really, because I just knew this was going to be a great interview, because I was just like, what? Really? But yeah, that is really awesome to know, just how different that can be. So, as women, we were talking about talking about sexual health and vaginas and things of that nature. And we're just going to keep saying vagina, just for fun. Okay?
Right.
Saying vagina. But, you know, at a certain point in time, you know, in history, not too long ago, it was just such a taboo topic. Where do you think we learn to equate taboo nature and shame with our bodies?
I think the U.S. culture kind of plays into that. That plays a big role. I guess society tells us that the vagina is something, you know, that should be covered and not really talked about in great circles. Or if we're talking about it, we kind of stigmatize it, like it has to be a certain way or look a certain way or, you know, smell a certain way. So I think that has a lot to do with it. I also think that some families are just not comfortable talking about vagina. I know my experience like that, we just didn't really talk about that. So
same here.
You kind of grow up with these feelings like, okay, this is not something I'm supposed to talk about or share with anyone, instead of just learning to love and embrace and empower yourself with the information.
Right, I agree with you, and I was also thinking like, growing up, it wasn't something to really talk about and to really have a lot of pride in, so to speak.
Right.
Like you said, keep it covered, you know, don't do this, don't do that, and I come from a generation where parents and grandparents, there was a lot of what not to do, you know.
Yes.
So
yes.
we'll get into some of those things. So the vagina is powerful. Just sitting here with you in our first few moments, it's just like, this is just wonderful. Like, I'm so glad that we did this interview. Do you have any recommendations on how to bring more awareness to our vaginas?
I think, like you mentioned it, like just saying the word vagina. Like, it is okay to use the actual name. Like, I've had patients and friends who just don't want to say the word vagina. They use all the other pet names. I think it's okay to say the word and just discovery, like explore your body. I know some women just never look down there, even when they're getting like pats and anals, which we'll talk about later. They have never taken the time to look down there and discover and figure out how their body works. I think by doing that, you empower yourself and you put power back into the word.
I like that. I like that. We'll be right back after a word from our sponsors. Welcome back to the Not Just Nursing Show. We are here with our guest, vagina health expert, Janelle King. Welcome back. So, as we all know, we've been talking about the vagina and vaginal health, and we can't talk about the vagina without talking about our menstrual periods. So we're going to get into that topic. I know this is not new. Hopefully it's not new. But just give us a brief sentence or just how you would phrase it, what a period is.
So a period is basically, it's the hormonal changes that your body, women's bodies go through in a month to prepare for pregnancy. So there are hormonal changes that happen. You release an egg, it travels down the fallopian tube, ends up in your uterus. At the same time, the body, your uterus is developing a lining. Your lining is getting thicker. So ultimately what's supposed to happen, sperm meets egg, conception, congratulations! You're pregnant. What mostly happens is that sperm does not meet egg, and then you shed the lining of your uterus, and that's the blood you see. So that's a period.
Right. And thank you for just giving us that visual of what an actual period is. You know how we were talking about different shapes of vaginas. So does that determine whether a period is lighter or heavier, or give us some insight into that?
Not so much a shape. So there are a lot of factors that play into whether or not your period is lighter or heavier. So lighter periods could be because of a number of things. Birth control could be one. It could be related to your weight. So some people who are underweight or lower weight have lighter periods or no periods. Some health conditions like PCOS could be a reason for not having a period or having lighter periods. Heavier periods can be also caused by a lot of things. So medical conditions like endometriosis, fibroids, those can cause heavier periods. Uterine cancer can cause that. Hormonal imbalances, that's one of the big ones that can cause a heavier period. And sometimes just giving birth, having a baby, after pregnancy, your period could become a little heavier. And then weight, again, like heavier weight can be another reason for heavy periods.
Okay, that's very interesting. I was thinking about PCOS. Tell us again what PCOS.
Polycystic ovarian syndrome.
Okay.
So to put it mildly, it's having a lot of different cysts on your ovaries, which can cause a lot of issues for you.
Right. Okay. I knew I had sometimes when we're in nursing, we have our words. I was like, I've heard of that before. What is that? I was like, let me ask you now, what is that? So when we think about the different reasons for lighter versus heavier periods, what comes to mind is the color of the red that we see. So is there any difference or reasons for like a bright red blood versus a dark or maroon colored blood, menstrual blood? What contributes to the color?
I think color sometimes is just depending on how, usually with blood and what color it is, it's depending on how long it's been in the body. So sometimes you'll see at the beginning or end of your period, you'll have darker blood, and then during your 2 to 3 days when your full onset period, it'll be lighter blood. So it just depends on how long the blood has been in the body and when it escapes your body.
Right. I know we were talking about just no topic is off limits here, so that is so awesome. And we were talking about odor, like sometimes with the vagina itself, sometimes I discharge and things like that, an odor, like a natural scent.
Right.
So what about odor for menstrual blood? How does that come into play?
So it is normal to have a scent when you're on your period, like a normal scent. If your scent is, if you're smelling something that's foul, that just does not smell right to you, that could mean there is a problem. I think in addition to that, some signs to look out for is just your flow itself. So for instance, if you're having a period that lasts longer than 7 days, if you are bleeding through a pad every couple hours, if you're having clots that are larger than the size of a quarter, if you're having blackouts on your period, those would be cause for concern. Or on the other end, where you haven't had a period in a number of months and you're not pregnant and are not sexually active, that could be a reason for concern.
Okay, and at that point, you would just recommend that the young lady just go in and see.
Definitely follow up with your primary care provider, GYN, nurse, midwife, somebody. Follow up with somebody.
Right. I remember back in the day, like the average age for a girl to experience her first menstrual period, I think it was like around 10 or 11, maybe 12. What is that age now?
It is, in the United States, it's still around 12.
Okay.
African American girls will have their period about 6 months sooner than white girls, but the average age is around 12. The range is anywhere between 10 and 16 is still considered normal.
Okay.
Yeah.
10 and 16, that's a large gap.
Yes.
That is a large gap. I was wondering, with all of the differences in food, and that's a totally different show, but all of the differences in food and hormones being added to milk and different things like that, does that contribute in any way to menstrual cycles for girls?
Yeah, so there's so much research being done in that area. One of the things they're saying is being linked to having periods earlier in our girls is obesity. So a lot of our kids are heavier than they were a couple years ago. Having more fat, and fat is what is needed to make estrogen, which is one of the hormones for starting your period, essentially. So having more fat as a younger child makes you start your period earlier. There's also things that have been researched like environmental factors, so like chemicals and toxins. Yep, they have said that those can contribute to earlier onset, as well as chronic stress early in childhood. So things like being in poverty or trauma, those also can contribute to having your period earlier.
That's very interesting. What kind of chemicals?
The research hasn't definitively said one way or another. They just know that they've done these studies and research shows it's having exposure to chemicals causes.
Just curious, because we're exposed to so many. And you're right. It can be in hair products. It can be in lipstick. I mean, all kinds of things. So you're right. There's no telling. Just chemicals. If it's not natural,
right?
That's why organic is just such a huge thing now. Because at least if it's from the earth, it has less of a chance to cause conflict. Within the body.
Correct.
So with our young ladies, needed to hear the talk about menstrual periods and then getting on into, of course, sex. do you believe that young boys should also be taught about menstrual periods?
Of course, yes. I'm a big advocate for both boys and girls knowing about menstrual health.
Good. That's really good to know. I don't remember in my household, of course I wasn't there all the time, but I remember my brothers, having that sort of talk. But I was just curious, like, should boys also, be taught that information? What do you think is, in your opinion, maybe one of the more safest ways to manage periods? And we're talking about like tampons versus pads, things like that.
So I just think that there are so many options available right now. The best way is to manage it is the best way that suits your lifestyle. So there are cups, pads, organic pads, cloth pads, discs, so many options available. So I always tell my patients, do the method that is going to be best for your lifestyle.
So you mentioned cups. Let's talk about these cups. I've heard of them just kind of in passing. How in the world do we use a cup? What is that?
So a cup is just like it sounds. It's a small little cup like this with a little stem on it. There are so many different brands that you can buy. So what is supposed to happen? You buy the cup, you sterilize it by boiling it, you fold it, and there are tutorials, YouTubes about how you get these folds, and then you insert it, and it is supposed to sit on your uterus and catch the blood. Okay. So you keep it there for a number of hours, and then you remove it, dump it, rinse it if you're in a place where you can rinse it, and then reinsert.
Really?
Yes.
So it's just using the same device?
Correct.
Really?
Yes.
So does it move? I mean...
No, and that's the thing. There are so many different brands, and I know some people, it's trial and error, just like you would with a tampon or a pad, like trial and error to figure out which brands it's best for you, but it's suction, so it suctions to...
Oh, okay, that's okay.
Yes.
At least it suctions. I was just wondering, like, oh my goodness. Because I always wonder, like, it's a cup, but...
I said uterus, cervix.
Yeah, cervix. Yeah, that is very interesting. So when we think about your previous experience working with the young adults, what sort of education do you typically give the young adults? So we're in college now, they're in class, they've had the sex talk and all of that. So what sort of education are you finding yourself needing to still give?
So a lot of times my conversations revolve around just assuring them that your period is normal. Like, this is normal, and what is normal for you may be completely different than what's normal for your best friend or your sister. Like, everybody is different. How you manage your period may also be different. So you may prefer tampons, she may prefer pads, and that's completely fine. And I also let them know, like, your periods may change over time. Like, you may be going through a period of time where you're more stressful. You may find that your periods are more erratic. If you have a baby, and after having a baby, your periods, like, the flow may change, the duration may change, like, things change. So I just assure them a lot of times that what's happening right now is normal. Here are the signs that you should look out for in terms of this is not normal, and make an appointment with your doctor.
I like that. Very much needed. Sometimes we think we get an initial introduction into a particular topic and that it just stays the same.
Right.
But what I'm learning here is that things change, just like life in general, right? And to be able to have someone such as yourself be able to have knowledge and be an expert and say, hey, everything is okay. This is maybe typical for you, but go ahead and see your doctor, if this situation persists. So thank you. You're feeling very much needed, physician. So thank you. We'll be right back after a word from our sponsors.
My name is Cara Sevier, and I am a registered nurse. With over 12 years' experience in the nursing field, I have had my fair share of long, grueling 12-hour day and night shifts. I have experienced what all nurses wish they had more of: energy. A year ago, I began to think about how this issue could be solved. I thought that the solution should be something that was easy to use, easy to carry, and would have little to no side effects when used in conjunction with other energy-enhancing supplements. 7 months and multiple ingredient trials later, the AM/PM Shift Energizing Spray made its debut. It contains natural ingredients as well as anti-aging and skin healing properties. Take control of your day with the AM/PM Shift Energizing Spray. Welcome back to the Not Just Nursing Show. We are speaking with our guest, vagina health expert, Janelle King. Welcome back.
Thank you. So we have been talking about vaginas, menstrual periods, all of that. And again, I have to say thank you so much for being the expert and just being so kind and open and creating a space for me to ask for you to be on the show. So thank you.
Thank you for sharing your space, Kara. I appreciate it.
Thank you. Thank you so much. So we're going to transition a little bit, just a tad, into sexual health. So this is just going to comprise vaginas, menstrual flows, all of that, and talking about sexual health. What is the number one thing to know in regards to sexual health?
The number one thing I usually tell my patients, my friends, family, sexual health is part of your overall health. So the same way that you would go to the doctor to get your glucose checked or your blood pressure checked, you should treat your sexual health the same way. Make sure that you have a provider, so whether that be a nurse practitioner, a physician's assistant, a doctor, somebody that you develop a relationship with, you trust, that you can go get your annual screens, and so that if anything does come up, you have somebody there and they can catch it early and get you the best course of treatment.
Okay, so that's good. It's kind of like having an additional component to like a well woman's checkup, for instance.
Correct, yeah.
Okay, and I think that was something I was going to ask later on, but we can review and we go there as well. So thank you for that. What age would you recommend to have the talk?
So yeah, that's a good question. I don't think, my personal belief is there's not a particular age that you should start having these conversations. What I do recommend is starting it early in your child's life. Kids are curious, by nature. My daughter asked me about 1,000 questions in 10 minutes. So the questions come up. Those are great opportunities to sit down, talk about things in terms they understand, in the context that they understand, and continue to have those conversations throughout their lives.
I think that's a great answer because everybody's different and things are different, way different now than they were back when I was a little girl. So you're right, these children are learning and hearing things and seeing things, and they're going to ask, and we have to be prepared at whatever age it is to not, shy away from it. I do have a niece, I do have young nephews, so you're right, it is to be aware so that when we're, visiting and all that, I'm prepared. Like, okay, if they come out of the box with something, okay, Clara, answer this, or how to respond. So that's very good to be prepared.
And I think in addition to that, just having these ongoing conversations, it makes the child comfortable, and then myself, me, we're comfortable just talking about
it. Absolutely. So I'm going to share my sex talk experience. And it was so funny, and I think it has worked a little too well. But my sex talk was from my father. May he continue to rest in peace. It was so interesting. It was 2 sentences. He said, and I'm just going to say it like he said it. I'm not going to try to get real grammatical with it. He just said, "Don't you bring no babies home. There are too many options." And I think, like I said, it has worked a little too well because there's still no children coming into the house. It was funny, and I got it. Okay, I focused on options. I was just like, okay, he's not telling you what to do and what not to do, but whatever you do, don't bring any babies here, okay? And then letting you know, you have options now. You figure out how you want to do that.
Right.
So I just thought it was hilarious, and I think it worked for all of us. As a matter of fact, I was 6 children, only 2 had children, and they, waited until, after marriage and all that. So I think it worked. I think it was effective. That might not be the case now, obviously. But I just wanted to share that. I thought that was just too funny. Have you heard of any other stories like that were hilarious to you?
So my own personal story. So I'm Jamaican. My parents are Jamaican. So very, very conservative Jamaicans.
Okay.
So they have a similar talk to me, you don't need to bring any children home, which is the case. That's why my sister and myself, we had kids later in life.
Right.
What I think was very helpful, though, I grew up in Toronto, Canada, and at the time they had comprehensive sex education in the schools. So starting from middle school onwards, we were taught about sex education. And I think that gave me a great foundation to understand how everything worked, to get knowledge about how to protect myself, what my options were, so that when I was ready, I was able to form relationships and make good sexual health decisions.
Right.
So.
I like that. And what you're bringing up is the different cultures too. So I'm sure that played a huge role.
Correct.
Jamaican, and then growing up in Canada, and then Canada is pretty, from what I remember, I've been there a few times, but they're a very open culture, right? And they kind of...
They can be.
Okay, yeah.
Depending on the background.
That's true. Yes, I think that worked well for you. Great. So 2019, I know we're 10 days in. 2019, what is still the best method to prevent pregnancy?
Don't have sex. That is the number one.
Yeah, I was wondering that was still number one.
That is the only guaranteed way that you will not have children. In addition to that, there are so many options, like you had mentioned before. There are so many options for contraception. So there's hormonal, non-hormonals. There are options that have been shown to be more effective than others. So the long-acting reversible birth controls, like your IUDs or your arm implants and Nexplanon, those have been shown to be more effective. Not everybody likes hormones. There are non-hormonal options. There's charting. There's non-hormonal IUDs. There are so many options available. And my recommendation is, if you are not planning on becoming pregnant right now, that is not in the cards for you right now, choose an option that works best for you.
Right. And what I'm hearing you say is that we already know, we talked about pregnancy and how that happens. So if you're planning not to get pregnant, then you have to plan with a plan.
Correct.
Right?
Yeah.
You can't just be like, okay, well, no, I don't want to have children, but then there's no sort of protection or anything like that, right? So it's kind of like, if you don't make the plan, then a plan will be made for you.
Yes,
It may show up in 9 months or
yes,
whatever. 7 to 9 months if you don't plan appropriately, right? Right. So some of these birth control measures, actually all of them, they have a disclaimer. It will say effective for preventing whatever percentage of pregnancy, but it will say not effective for preventing STDs and STIs, or sexually transmitted infections. Let's talk about that. What are the best ways to prevent STDs?
So the number one way, don't have sex.
I know, right? Okay, is that the slogan?
Don't have sex.
Right.
But in addition to that, there's a couple different things. Like, if you are in a committed, monogamous, long-term relationship and you guys are only with one another, I always recommend getting tested going into the relationship. Both of you make it, I don't know, a date. Go get tested, know what your status is, know what your partner's status is, and talk about that. In addition to that, there's always condoms. Figure out how to use a condom. There are different options: latex, non-latex, sheet, male, female. Condoms are the best way, or the most effective way in terms of preventing STIs.
Okay. So, of course, the big one, we think about STDs, we think about HIV. My question would be, are there any STDs or STIs that are small enough to fit through the barrier of the condom? I think I saw something one time that, some diseases can actually, filter through. Is that true?
That is partially true. So condoms are good for preventing STIs that are transmitted through fluids, so vaginal and semen fluid. So gonorrhea, chlamydia, trich, those are prevented by using a condom correctly. So those STIs that are transmitted via skin-to-skin contact, so we're talking about pubic lice, we're talking about herpes, syphilis, HPV, those ones, condoms are not as effective in terms of preventing those ones.
Wow. So I think that gets into what you were saying. I guess the best preventive method is to see, first of all, if you have already been exposed to that. And like you said, with that partner, hopefully a long-term partner, you just find out basically where you stand. And then hopefully stay that way. So that, yeah. Wow, that is really interesting. What are the numbers now with the rate of HIV infection? First of all, in the U.S., if you have that, and then also like Atlanta, do you kind of know where we are now?
So the good news nationally is that in recent years, the HIV rates have been, and I'm talking about newly diagnosed cases of HIV, have been trending downward.
Oh, good.
However, in my personal belief, is one case is too many. Yeah. So in 2017, I think it was just under 39,000 for the U.S. Women made up about 16% of that number, newly diagnosed HIV. In Atlanta specifically, I think we're fourth in the nation in terms of new HIV cases, and that's a pretty big deal. I've read studies and research that said that the newly diagnosed case of HIV in downtown Atlanta is comparable to the rates of the country of Zimbabwe. So that is really, really concerning.
That is substantial, isn't it?
Yeah.
How often would you recommend getting tested for STDs, and HIV testing, I'm sure, is in that bundle as well?
Yeah, so the recommendation is specifically for HIV, they recommend getting at least one test per lifetime between the ages of 13 to 64.
Okay.
For gonorrhea and chlamydia, for women specifically under the age of 25, they say annually. For older women, if you have high risk, so let's say you have multiple partners, again, that would be annually. Depending on where you present to get your test. So if you're in a doctor's office, it may be different than if you go to an STD clinic. At STD clinics, they may also test you for trichomonas and herpes as well.
Very good. I like just having the conversation about where a person fits in. That way, it's personal, it's individualized. You know, nobody is the same, so it's true. If you are more susceptible to contracting something, then that's true. Get tested a little more often.
Right.
That way, it's not, a huge surprise. What would be the number one thing to do to have a healthy sexual life? What would you recommend?
Healthy sexual life. So, a couple different things. Again, I'm always going to preach prevention, so making sure that you have a provider that you see annually for your tests. Make sure everything going on downstairs is correct. Making sure that you have a conversation with your partner, and just having that open communication with your provider as well as your partner to make sure that your needs are met.
Absolutely. When we talk about sexual health, of course, we get back to the vagina. So pap smears, those are preventive measure for cervical cancer. Is there an age that we would recommend, or that you would recommend having the first pap smear, and then how to manage that?
So clinical guidelines have changed in recent years. So an actual pap smear, and which is different from a pelvic exam, the recommendation is the age of 21, regardless of sexual activity. So if you're having sex or not, the recommendation is to start your pap smears at age 21. They don't recommend doing it younger just because women who maybe develop something, usually with time, they found that the body clears itself, so it's kind of redundant to do that. So age 21 is the recommendation. And then after that, it's depending on a lot of different factors. Usually, generally for most people, you can then start having it every 3 years.
Okay, every 3 years. Okay. What are your thoughts about methods to also help keep the vagina healthy, such as vaginal steaming, douching, things of that nature?
So I'm anti-douching, just because, like I mentioned before, the vagina has its own pH.
Okay.
So anything you insert into your vagina that can throw it off and cause more problems. That's why I'm anti-douching. Vaginal steaming, that's like a new thing. I hear a lot of information, everybody's talking about it. I don't have an opinion one way or another. What I do know is that there have been cultures that practice this forever. I know women who do this and they love it. I don't know how I feel about it just yet. I got to do a little bit more research on that one.
I'm going to share something kind of personal, and it's regarding vaginal steaming. There's a place here, and I don't know if you've heard of Jeju. Okay, so I went to Jeju here in Atlanta, and they do have like a vaginal steaming service. And on the wall, they have, it's in Korean, and they show pictures of the herbs that actually help to prevent certain things. And I think it's really good. That's just my non-clinical opinion about it. But you basically kind of sit on this stool, and they put the herbs with water in this pot that heats up. And the stool kind of looks like a toilet. It's kind of open, and then you have this cape on to kind of keep the steam in. And you just sit there for, I think, like 30 to 40 minutes. And it's just all herbal. And so to me, I think that would be healthier than inserting anything, and then a chemical, we were talking about chemicals earlier. So, and I'm a huge fan of cultures. And wherever they got that from, I know that it wasn't just made up. So, I know that it was passed down.
That's exactly why I feel like I can't say it's bad or good.
Right.
I know that there are so many cultures that have been doing this forever and have seen benefits. So.
Right, exactly. And, anything that's natural, I would think would be more helpful than harmful. So, me personally, I'm not going to recommend it, but definitely if, a young lady is open to trying that, it's just a lot of health benefits from that, and you can kind of Google and see what those are. But definitely, I've experienced it, and if it wasn't so far, it's kind of far, it would be something that I would regularly do. And now I'm starting to see nurses, nursepreneurs actually have this service. So to be honest, that may be something that will be on the Not Just Nursing show, believe it or not. Believe it or not. But just because we have to talk about these things and be able to show how our communities can be enhanced or improved. So that's an awesome thing right there. We're talking about vaginal steaming, vaginal health. So how the vagina changes during different points and times in life. For instance, how does the vagina change after giving birth?
So some women may experience more looseness down there. Like I mentioned earlier, the vagina, it's a muscle. So you're pushing out essentially a watermelon out of a tiny hole, so it may get stretched. There are a couple things that you can do to help with that, one being Kegel exercises. So those are your Kegels help with your pelvic floor muscles. So the same muscles that you would use to stop your peeing midstream, those are the muscles that you want to tighten and release. You do that a couple times a day. You do sets of 10 a couple times a day, and that's been shown to help improve those muscles. So for some women, that Kegel exercises, that's just not enough, and you may need to see a physician's assistant who specializes in pelvic floor dysfunction. They sit with you, they come up with a plan of exercises to help strengthen your pelvic floor, get those muscles back where they need to be.
So what I'm hearing you say is that there are exercises to strengthen the vagina after giving birth. Are there surgeries or surgical options? I think I've heard where there can be some sort of vaginal surgery, and I don't know if I really don't know what they do. Janelle, I don't know if they're cutting off certain parts of the vagina. Tell me what that's about.
Depending on the looseness and what's going on down there are like surgeons that will go back and repair if that's what's needed. But you may be talking about vaginal rejuvenation surgeries, which I don't know a lot about. I just know that women kind of go in, they feel like it's too loose, and they kind of like tighten everything up in there for you.
Yeah, I was just wondering if they, I don't know what if they're removing a part of it and kind of shrinking, cutting out the extra piece. I don't know.
It could be, yeah. I don't know a lot about it, but I have heard that some women just want it back to where it used to be. And like after giving birth to, if you have a lot of kids, it can be kind of loose.
Yeah. And like you were saying about the sexual health, if women are still making that a priority, I could see where it's like, okay, let's go ahead and now, fix it as an option. So how does the vagina change after age or throughout the aging process?
Couple things. Again, looseness can happen. Estrogen kind of decreases as you age, so looseness, Kegel exercises can help with that. In addition to looseness, you can get drier down there. So less estrogen means, and the estrogen is used for lubrication, it keeps it elastic, keeps it good and functioning. So women, as you age, you have less estrogen, you find that it's drier down there. So a lubricant can help with that. And also talking to your doctor about if that's not enough, vaginal moisturizer is not enough, you can talk to your doctor about various different options to help with that as well.
Awesome. So the thing is pretty much just communicate with an expert, such as yourself, and then like you said, you refer people, to their gynecologist or whomever is caring for them. But just having that conversation is kind of the pathway to getting, the situation addressed.
Definitely, just because, women, we're all individual beings, we have different criteria and factors going on, so we always want to find the best answer, personalized answer for you.
Right, right. So it can be kind of tailor-made as your personal treatment plan.
Exactly.
So I want to move into something I saw on your blog, and it was just so awesome. And this this is about vagina-inspired gifts. Please tell us about that. That is just so cute.
Yes, it's so much fun. So instead of giving like the traditional gifts to your bestie or your sister, think about things that are vagina inspired. So on my list, I listed things like period panties. So yeah, that's an actual thing, period panties. So these are panties that are designed to hold menstrual blood. So you can wear them on your lighter days, and then it's designed to be a backup to your regular methods, so tampon pads, whatever. So the ones I chose were Dear Kate. It's a female-headed company out of New York. They make period panties, dance wear, fitness wear. That's what it's designed to do. And in addition to that, My Lab Box, so another company, US-based company. So some people are just shy about going to the doctors for STI testing. I get that. I understand that. So these are products that you can buy and ship to your home, and you can test yourself. So you swab, test yourself, put it in the mail, send it back, and they email you your results in 3 to 5 business days. So there are boxes that are designed specifically for women, so test for gonorrhea, chlamydia, trichomonas, and bacterial vaginosis and yeast. So I thought it was a great product for those women who have that option of testing at home. In addition to that, we talked about natural tampons.
Yeah.
So Tampon Tribe is a monthly subscription company. They send tampons and pads, 100% natural, 100% cotton, right to your doorstep. So you figure out what you need, and they have pre-made packages, or you can kind of design your own. They send it to your house once a month. The no more needs to run to CVS last minute. That was great.
You're right.
Pleasure Pantry is another subscription box. So if you're trying to spice up your sex life, you might want to think about Pleasure Pantry. So once a month, they curate a box of goodies, adult novelties for you, and they send that to your home. You fill out a questionnaire based on, your likes, dislikes. They send it to your home. You try them out with your partner. You get a new box the next month. Awesome, I think.
Yeah, that is nice.
Yes.
Yeah.
And then lastly, I'm a tea drinker, and some teas have been shown to have benefits for PMS. So I found this great company. It's out of Toronto, Canada. I gotta support my Canadian company. So they make organic teas. There are no toxins, no dyes, 100% loose leaf organic teas. They have a variety of teas that you can order, sent to your house. In addition to that, what I loved about the company is that they support female entrepreneurs. So they give away $1,000 every month to entrepreneurs. All you have to tell them is why you should deserve this money, and they pick people at random. So I thought that was awesome as an entrepreneur and
awesome. Can you share the name of that? Because I'll be writing
it was called Bon Ton Tea. Yes.
Oh,
yes.
Okay, I like that. And then just that mission to help the entrepreneur community.
Correct.
Oh, that's nice. Wow. So you just mentioned something about the gift, about the box that you can share with your partner and have a subscription to that. That brings us to our final question. What is the #1 thing to do to enhance your sex life?
In my personal opinion, and it may be a little taboo when talking, masturbation. So, yes, there's this whole movement, research has shown that masturbation helps self-exploration, whatever you want to call it, helps with enhancing your sex life. So it helps to increase your libido, it helps you to develop body confidence, you figure out what you like and you don't like, and you communicate that with your partner. I think it's awesome, and I think that men talk about it a little bit more, right? And as women, that's not something we talk about. But yes, these studies have shown that that's what helps to have a long-term sexually satisfying relationship, and it also helps with mental health. So
mental health.
Yes.
Because you were saying sex is really a part of life.
Correct.
And if you don't have that balance, that's what you were saying, you need to have that evaluated to see what's going on. That's really, really good, because I think at one point growing up, that was just another taboo topic, masturbation, and you say the word, it was just something looked at as dirty, you know what I mean? It's just, so things have changed in regards to sex and vaginal health. Some things remain the same, but I like #1, as I mentioned, you being able to be the vagina health experts. We can have these open conversations, and it does spur me into thinking about part 2, so that we can talk about, maybe get a hold of some of these products and kind of review them or talk about them.
That would be awesome.
Yeah, so let's collaborate on that. and just get together and be able to share more information on that. So Janelle, tell our viewers where they can find you on social media.
So you can find me on Instagram, Twitter, Facebook, The Nurse Note. I love questions. I love receiving questions. I take the time to answer. I love sharing my passion and knowledge. So please send me messages, DMs. Find me at The Nurse Note.
Perfect. And your blog, I want to make sure people are able to read your blog because you have some awesome blogs and very informative. And I love your website. And just let them, and everything, like you said, it's thenursenote.com.
Thenursenote.com. Yes, I have some awesome blogs, like she said, and some new information and blog posts coming up.
Yeah. Do you have any events coming up that we need to know about? Because we definitely need to support you.
No events in just yet, but 2019 is really early. I do have some great partnerships coming up. I am partnering with another health blogger here in Atlanta. We're going to put something together for next month. I'm doing a review. It's so funny you should say about vaginal steaming. I'm doing a review on Goddess Gift Box. I've been sent some products, so I'll be writing a whole review about that. And I'm also, I love vaginas, but I like to treat the whole woman. I'm also doing a review on a product that was sent to me. It's about coloring, adult coloring. So it's an adult coloring book. It's for women of color. Coloring has been shown to help with mental health and depression and stuff like that. So I'm going to review this product and let you know all about it on my website, thenursenote.com.
Perfect. And I'm glad you brought up the Goddess Gift Box because you and I were talking the other day, and we will mention her name, Bianca. Bianca, we just want to say thank you for sending your Goddess Gift Box because I also received one. And I was sharing with Bianca that I'm going to open her box and also use it and review the product as well.
So we'll have to trade notes.
Yeah, we'll have to trade notes and then communicate with Bianca. So Bianca, thank you so much. GoddessGiftBox.com, and we look forward to trying your products and doing a review for your products. So congratulations on being an entrepreneur. So we just want to say thank you so much again, Janelle, for being a guest on our show. Totally enjoyed you. It's just so much fun.
Thank you so much, Kara, for sharing your platform with me. This was an awesome experience.
Thank you so much. You're so welcome. See you next time on the Not Just Nursing Show.